I'm Dr. Zanetta Forson-Dare, a third-year neonatal perinatal medicine fellow at Yale New Haven Children's Hospital, and this is my presentation on my study of racial and ethnic disparities in exclusive breastfeeding during the post-delivery hospital admission. Racial disparities in breastfeeding in the United States are well documented, with non-Hispanic Black women having the lowest rates of initiation and sustaining breastfeeding. This is in spite of them identifying breastfeeding as the healthiest feeding option for their babies. It is a really important issue given that breastfeeding confers multiple health benefits for both mothers and infants. Therefore, the persistent racial disparity in breastfeeding presents as an issue of social justice. We conducted this study to look in detail at one aspect of the breastfeeding journey, post-delivery, and whether mothers that intend to breastfeed are able to achieve that goal and how that differs across racial and ethnic groups. This study was a retrospective chart review of 2 years' worth of data of healthy mother-infant diets in a tertiary-level teaching hospital in the Northeast. We primarily looked at maternal intent to exclusively breastfeed versus achieving exclusive breastfeeding using the predictors of different racial ethnic groups while accounting for the covariates in maternal demographics, medical history, and infant birth characteristics. The gap between racial ethnic groups and intent to breastfeed was smaller than actually achieving breastfeeding. In fact, the adjusted odds ratio among women who planned to exclusively breastfeed showed that non-Hispanic Black women were half as likely as non-Hispanic white women to achieve their goal, and this even persisted when we used prima gravida women in a subgroup analysis to exclude confounding by previous breastfeeding experience. In women who planned to exclusively breastfeed but did not achieve it, we assessed the reasons for formula administration, and one of the interesting findings was that non-Hispanic white women were more likely to be given formula for an infant complication and non-Hispanic Black women for maternal request. We also saw that as a group, Hispanic women were more likely to be given formula for maternal request, raising questions around possible language barriers with healthcare providers. This disparity in nutrition from intent to breastfeed to achieving breastfeeding in non-Hispanic Black women compared to non-Hispanic whites is concerning. Personal commitment to breastfeeding and self-efficacy must be explored. However, given the documented structural racism embedded in the U.S. healthcare system, it is appropriate that increased concerns are being raised around the influence of this in breastfeeding support and education. A brief current literature review of structural racism in breastfeeding support is featured in the poster. This study has highlighted a key period of time after delivery with a rapid decline in breastfeeding affecting non-Hispanic Black women the most, and continued research is essential to identify exactly why this occurs and how to intervene. Thank you for listening, and thank you to my collaborators, Dr. Veronica Shabanova and Dr. Sarah Taylor.